Hey, welcome for joining us. I'm here with my friend John. He's been a patient for
10 years.
Probably. And we're going to do a cyst on his back. It has been there for years.
Years.
And what happens with it?
It just fills up with a white gooey substance that does not smell appealing, and it's time to get it removed.
Okay. And you've had stuff come out of it lately, right?
Oh, yes.
Yeah, okay. So we're going to get this taken out. It's probably an epidermoid cyst, feels like one. And by outlining the margin where you can feel the raised part of it, we can get an idea of how large it is, at least how large the skin around it is, and take it out probably with an elliptical excision. That would probably work best. Many of our viewers have probably seen Dr. Pimple Popper do a similar procedure. Oftentimes she'll use a punch biopsy first and then dissect around the cyst. We're just going to go in with an elliptical excision on this case. First inject where it's going to be. Feel that, John?
Oh, yeah.
Sorry. You're always so easygoing. You do feel it though, right?
Oh, yeah.
Okay. One of the things I'm not thrilled about with this going into it is that it's had a lot of trauma to it with the squeezing and the healing and the squeezing and the healing. And so it's going to be kind of tough with some scar-like tissue. Might make it hard to get a nice, neat removal of a sac all in one piece. The sac may actually be ruptured at the moment. When I was feeling it before we got started, I was able to feel the edge of it. You can't do that once the anesthetic has filled all of the superficial tissue. It's all hard and firm. So you just kind of have to go by your landmarks, which is the drawing with the pen. I'm going to make a vertically oriented ellipse, and then we're going to dissect the cyst out once we do this. So that's one side of the ellipse. And this is the other side of the ellipse. So now I'm going to sort of trace what we just did, but what's nice is the blade likes to go in where I already cut. So it's not like I'm totally blind to it. I can kind of feel that I'm in it. And the reason I'm not just aggressively going ahead and going in is because there's a cyst that will rupture inside of there. And I don't want it to rupture if I can help it. You'll see different techniques watching the different channels. Yeah, even just watching one channel, you'll see different techniques. One of the things that you're noticing is how thick the skin of John's back is. Not terribly unusual for a back to have skin that's really thick. It's not that John's just thick-skinned.
Yes, I am.
So please do add comments if you have comments about John's experience here, or similar experiences you've had. Miley. Let's look down here. Does anybody else see that? Mm-hmm. Right there? Mm-hmm. I think I want to dissect around that. I'm just finishing getting through the skin here. And you can see how it's, I don't know if you can see, yellowish fat. It's actually about the same color as the skin.
Oh, yeah.
But then we come over on this side and we have this white structure below the skin. Mm-hmm. Right there, kind of roundish looking. I don't want to use a sharp knife right on that. I want to use, well, scissors are sharp too, but scissors, if you go in and separate like that, can do what we call blunt dissection. Separate, as Dr. Tan used to say. I'm just freeing up around it. but being careful not to rupture the cyst, because I think there's lots of videos of them where the doctor ruptures the cyst and squeezes it all out, because there's a lot of people who love seeing that stuff come out. That, you know, after all, it's Dr. Pimple Popper. There's something satisfying about seeing all that come out. I think there's something satisfying about taking it out in one piece.
Okay, Mr. John?
Doing fine.
Okay. They're both interesting. Being oh so careful. And if you happen to be a physician who does this procedure, please comment. We would love to hear words of wisdom you have to share with us. Okay, look at that. Totally intact. Now, other people, we will get comments, if I don't cut them off now, saying, oh, please, why didn't you open it? Why didn't you get all the contents out? Look at that, because I want to give it to the pathologist just like that. I want them to have the whole thing to look at. Look at that. That is beautiful. Now, the reason I'm not putting a suture in at the 12 o'clock location on this one is because we're not concerned about a cancer and whether it's still left behind. We're just sending them off a cyst. It's a centimeter, maybe 1.1. Take a big bite of the deep part there, starting from lower and coming out higher, and then going to the opposite side and starting higher and coming out lower. See what I'm doing here? Okay, so what I'm doing is making it so the knot is going to be at the bottom. And this pulls the deeper tissues together to take some of the tension off of the skin. There we go. Good. All right. There. It's holding now, John. And then you cut it just above the knot. Is that more comfortable?
Yeah, for right now.
For a change?
That might help to
make you taller?
no, get the skin more together.
Oh, you're a genius, John. It worked. Don't move. You'll notice because of how tough the skin was, it actually bent the needle. It normally is a different curve than that. It's more of a curve. He straightened it out. Straightening the curves. What's the song? Would it help if I told you it was from a television program? Would it help if I told you what the visual was that went with that line of the song? If I give the character name away, it gives it away. Or the name of style of shorts.
Was that from Dukes of Hazzard?
Yeah.
I don't remember that.
That was Hank Williams Jr., wasn't it?
If it's not, you're going to hear about it.
No.
Comment below. Look at this.
That looks good, Doctor.
Look at this. All that trouble to come up with a beautiful vertical linear scar. There's a song about that too. Jim Morrison's Grave by Steve Taylor.
Yeah.
Okay. 5, and my sense of aesthetics is killing me to not have one located here. Is that bothering anybody else to not have one there?
Yes.
But it's not necessary for it to heal. It's just... All right. So we will have Ian put a beautiful dressing on that. Just beautiful, totally intact. The pathologist will take it apart and tell us what it is. John, did you see it?
No.
Oh, you got to see it, John. Oh, see that thing? That's what Denise has been squirting out of you.
Yep.
So there's a lot of tension there still. We do want you to not be doing things where you're really pulling with your arms that will pull on this a lot over the next 10 days while we're leaving the sutures in. And now that you're on this side of it, you've experienced it, what words do you have for people who might be going under a similar procedure?
Not a problem. It was a lot larger than I expected it to be.
Sometimes they are, yeah. But we got it out. We have John. He came back because he thinks he may have broken a stitch from the procedure that we did. Let's check and see. It looks good from the outside. Did you feel something, or was there pain?
No, when Denise changed the bandage this morning, she noticed that where there were 6 stitches, there's only 5, and you can see where the holes are. But the stitch wasn't in the band-aid, so we're just want to make sure it didn't suck inside or something.
Do you feel it?
Mm-hmm.
When I pull on it?
Yeah.
That's the vertical mattress. The knot is to the side, so it's intact.
Oh.
It's just where the incision is. That's where the suture goes under and across and back out. Let me close this up, and then I'll draw you a little diagram showing you exactly. If this is the wound, and this is the skin above it, the way that suture works is we go in and we take a bite and we come out, and then instead of tying across here, we go back in and take a bigger bite and then tie it over here on the side, so the knot is off to the side. And it allows us to get a lot more surface area that the suture is pulling on because we had all that tension. So actually, even though you're concerned about it, I'm really happy with that. Like,
Excellent.
yeah, so you're not hurting.
No.
Okay, so this is the day after we did it, right?
Correct.
Post-op day 1, doing well. Hey, thanks for watching, guys. You even got to see a little bit of follow-up there with the day after. So John's doing great. And if you haven't already subscribed, please do subscribe to the channel so you don't miss future videos. And if you want to watch some more, you can see a little video that you can go to now to watch more procedures with the Auburn Medical Group. Stay in good health.